hepatocellular cancer, most common type of cancer in the liver. And we can't do surgery because your liver's damaged too much. The chances of you bleeding to death would be far greater than they would be of successfully removing the tumors. So they told me that eventually I would need a transplant. That was last June. So I went through the pre-transplant list criteria that they require, and I successfully completed those, went through all the tests that they wanted, and I was put on the list last June.
Were you given?
But what they did tell me was what the MELD score was, what the criteria are that make up the MELD score, and they continuously monitor those things. I take MRIs every 3 months, liver, spleen. I have CT scans of the abdomen, the chest, regularly, because they want to see if there's any, if it's metastasized.
What was your MELD score?
Originally it was a 22, I believe. It is now a 29, and I think I'm due to get upped again.
So MELD score is what we used, what's used nationally in terms of how livers are allocated, as opposed to kidney transplant, where it's based upon how long you've been sitting on the wait list, and the longer you're on the wait list, the higher you go up. Since 2002, to allocate livers, we've used MELD scores, and the MELD score is based upon different lab values, and it generates a score from 6 to 40. And people are ranked based upon their MELD score. So someone with liver disease might have a MELD score of 15 one day, they get an infection, and the next week their score can be 30. And vice versa, it can be very chaotic in terms of their score. In contrast to that, someone with liver cancer, their score is based upon their cancer being within criteria for transplant, MELD criteria. So they start with a score of 22, and as long as they stay within criteria, and that's why every 3 months we get imaging, and we make sure that their tumor is well controlled and treated, their score goes up every 3 months until they get to the top of the list and they get a transplant. So it's, we can say on average, in this area it's going to be a year or year and a half wait, depending on the blood type, to get to transplant if you have cancer. Yeah, so in contrast to many other areas in the country where people, are getting transplanted right at a score of 22 within the first 3 months of getting that first score. In fact, about half the people who've been transplanted for cancer, if you look back at the data, are getting transplanted that quickly. And but places like Boston, New York City, San Francisco, patients with cancer have to wait a significant amount of time in order to get to the top of the list and to get a liver. And that it can be very difficult for the patients and for the providers as well, because here's someone who has cancer and you can help them, but it's really a matter of a waiting game, and hoping that every 3 months when you get those scans and those lab tests that their tumor hasn't gone beyond the criteria, because that's a hard phone call to let them know that their tumor has progressed, and you're at that point having to take them off the transplant list.
Well, probably from 2011 to 2013, so 2 years. Yeah, it just seemed to take too long. I mean, okay, now I know I need it. How long is it going to take? And the way it was explained to me essentially was, they were quite honest when they talked about it. They said, you're going to have to be very sick before we will transplant you, in terms of the numbers that you need in this region. And they were right. I was very sick by the time I received my transplant.
After your transplant, how long did it take to feel like you were getting back to normal?
I felt good really quick. I was out of the hospital in 1 week. I was on a mission.
Yeah.
They told me I could leave if I got up and walked around 2 times. So I started walking as soon as I could move, and have kept going from there. But yeah, I felt really a big difference pretty quickly.
Great patient. Very motivated.
I was
You're
definitely
probably pretty tired of
motivated.
being sick.
I was tired of being sick, and it's amazing, you don't realize just how sick you are you know, you get lethargic and you're thinking, they say, you know, well, do you feel like you're not thinking? Well, I feel like I'm thinking fine.
Right. And
Did
then
you ask
it's-
me a question?
And so it becomes the norm.
All right,
yeah.
so but as soon as I got the liver, it was very quick that my mind started speeding up, and I'm going, wow, was I slow? And all of a sudden, things start coming into, you know, my mind's in much tighter focus. I was ready to get, okay, what can I do now? Am I allowed to?